Let's get oral.
Welcome back to Let's Get Oral. I'm John Dornell. I'm here as usual with our lovely co-host Camille Zenobia.
Hello, hello.
Yes. And today we are super stoked to be sitting down with Dr. Sabrina Porcher-Fennell. She is a dental public health practitioner out in North Carolina who did her bachelor's training and her dental work at Claflin and respectively Meharry College. So we got HBCU alums in the house. So welcome to the show,
Yes.
Dr. Sabrina.
Yes, thank you for having me. So excited to speak with you all today.
Yes. One of the few reasons I was really excited to be able to have this opportunity to chat with you more is throughout this year, we've been having a couple of different series focused on topics with regards to oral systemic health. So we've had great conversations, not just focused on the mouth, but the role that the mouth plays in heart disease, heart health, brain health, airway. However, what is one of the underlying themes amongst this that I feel like doesn't sometimes get highlighted enough is that systemic link when we talk about we the people in the public and in the community. So I'm really excited to, uh, as Camille would say, pepper you some questions to learn not just more about you and your journey, but also from your perspective, the role public health dentists and care providers such as yourself play in this ecosystem.
Sure.
So, first things first, we would love to have you spend some time telling us and our listeners a little bit more about your journey into public health and becoming a dentist. How did that start?
Absolutely. So I didn't decide to become a dentist until I was in college. And it was actually my biochemistry teacher that recommended I look into dentistry. And I was like, okay, that's okay. Because initially I wanted to do medicine and I decided I was like, well, I guess everybody's not going to get into med school. So what school can I get into? I was a biology major, my chemistry minor, so I always stuck with science. So I figured, well, let me see what I want to do. And I did a SMDEP, a summer medical and dental education program at the University of Washington in Seattle. So that's what really gave me my foundation of wanting to do dentistry. I found that it was a little easy for me to do it. They had us do like some wax ups for teeth and make impressions, and I was just like, oh, I could do this. Okay. And so I didn't realize that dental school accepts even less applicants than medical school, but that didn't matter to me because at that point I had really went all in and decided, yes, I want to become a dentist. This is what I want to do. And
Wait,
so
I'm gonna hold on. I'm gonna stop you there only because, oh my gosh, a biochem teacher suggested that you were gonna do dentistry.
yes,
What was that?
she did.
That's amazing. I would have never, I know for sure my biochem teacher, it wouldn't have been on a list of options.
Mhm.
So how did that, why? Tell us more.
So I went to her office and her name is Angela Peters, Dr. Angela Peters. Thank you so much. But I went to her office and I said, Dr. Peters, everybody in our, because of course you start off with like 80 to 100 students in the biology department, so everybody when they come they're like, I want to major in biology. And we had a speaker come and the speaker said, how many of you want to go to medical school? And like the whole class raised their hand and I looked around and I was like,
Yikes.
that's that point, I said, everybody in here is not going to get into medical school. So what could I do that I could still be a part of medicine, healthcare, in general? And I went to her and I said, I need to know what else can I do besides medical school. I said, because I think this is like why everybody's majoring in biology. And I majored in it because I love science. I had always, loved science as a kid. And so she said, what about pediatric dentistry? She said they need Black people in the field of pediatric dentistry. So she actually told me
Wow.
pediatric dentistry. And I just said,
Pediatric.
okay, I'll look into it. And she said, I think you would be really, really good. Just look into it. And so that's what prompted me to actually apply for the SMDEP program. It was all expenses paid. They paid for my flight. They paid for, because at the time, of course, it's in South Carolina. So they paid for my flight. We were housed on the campus, and that was my kind of like experience with like different people, because they brought people together from everywhere, because I think Yale had a similar program, Columbia had a similar program, but I wanted to go far because at that time I hadn't really traveled outside of South Carolina that much. I mean, I did some travel, but it wasn't like to the West Coast. And I was like, well, I want to see what's on the West Coast. So I just had that curiosity. And so I loved Seattle. It was very picturesque. I mean, we did exercise. I mean, it was just a great experience. But that experience led into,
Sorry, I'm so glad to hear that because that's where I did my PhD.
yeah,
I'm from Seattle, and anyway, so I'm
hmm
glad you were in the dental wing. It's a wild ride over there.
yes,
I'm so glad you
yeah.
enjoyed it. So it led you to I'm sorry, I interrupted.
Yes, it led me to dentistry. So that is where it all started for me pretty much. And, I remember being on the campus and deciding this is what I want to do. Like this is where I want to go. And so when I got back to South Carolina or got back to Claflin, my goal was to get into dental school. That was all I knew. I was like, I have a mission. This is my goal. And so I shadowed a lot of dentists. I had a local dentist, Mona Ellis, shout out to her. She let me shadow in her office. So, while I was in college. So I spent a lot of time in her office. She was a periodontist. So we're talking about public health. People don't really talk about periodontists because they are specialists of the gums, of the teeth, of the bone. And we see a lot of people with periodontal disease. What is that? And so I learned a lot from her, surgery wise as well. People don't really consider periodontists surgeons, but they are. And so learning implant placement, all of those things I did in her office. When I would go home during Christmas time, I also shadowed dentists. So I didn't have downtime. I didn't break. I stayed consistent with, okay, this is what I want to do. So I continued to immerse myself in that space. So I had a periodontist at home I was shadow, or a surgeon I was shadow, a GP that was a former ENT. So he did his own venipuncture, he did his own lines, he did his own anesthesia in the office. So I had a very, robust group of, I would say, mentors early on, even before I got to dental school, that I was able to really see if that was something I wanted to do. They all were private practice owners. They did not work kind of in the public space, but they dealt with the general population, where their office was. And so, of course, not seeing a lot of the business side, but just seeing that they had assistants that were loyal. Their assistants, they, watching them how they gave Christmas gifts and, just different nuances that you don't see or pick up in dental school. I kind of got that before I went to dental school. So it was a little bit easier for me to kind of transition into dentistry or into dental school when I got there. So that was pretty much the start of how I ended up there. So when I finished residency after Meharry, I did a residency at the VA hospital in Memphis, Tennessee. So, shout out to Glorilla. Let her cook. I cooked in Memphis for a little while. And so that was an experience for me as well, and that experience was where I developed a lot of the clinical skills that I utilize even today, especially with surgery. The chief dental officer was an oral surgeon. So all of the
I
cases,
see.
we took to the OR. We did a lot of surgery cases, a lot of implant placement, a lot of implant restorations. And so I got a lot of that from that residency, in thinking that I wanted to kind of pursue a cosmetic side of dentistry, which is kind of polar opposite of public health. Because in public health, you deal a lot with preventative. You don't really deal in the cosmetic space. And so one of my mentors there said, well, you should think about that population. Do you want to serve the population
Mm.
that you would have to deal with cosmetic dentistry? And of course, I didn't think about that. You know, when you have mentors around you and they pose different questions, it's
Yes.
not to try to deter you from doing certain things, but it's just to allow you to think about, you know, what does that space look like? And I
Right.
think a lot of times, you know, when you make decisions, you don't really think about, is that the space I want to be in, or will I be successful in that space, or what would my contribution be if I went to that space? And obviously, if I went to that space, we wouldn't be talking today because you know there's really no public health in that. And so I decided at that point that, you know, I would practice. At that time I wanted to be 100% clinical, but I had a challenge when I left Memphis, when I tried to move back to Nashville, because Nashville, Tennessee is where Meharry Medical College is, because I had gotten married in dental school. And so my husband was still in Nashville. I was commuting back and forth.
Yeah.
And so I could not find a clinical job in Nashville, surprisingly, even though I had my residency behind me, you know, which is an extra year of training. Typically, dentists do not have to do residency. We could graduate and go straight into practice because we
Hmm.
get, you know, we can sit for boards and get licensure and all of that stuff. But at that time, you know, they were like, we want somebody with 3 to 5 years of experience. And so, you know, it's funny how the tides change, because as I mentored students throughout the years, the requirement became less and less. Like, so now they target new graduates. They're like, we want new graduates to come. And I'm like, wow, what happened? Like 3 to 5 years, now new grad. So, you know, it was just one of those things. So I ended up on faculty. So I actually was a faculty member at Meharry Medical College when I came back from Memphis. So I did a lot of didactic training. I did clinical training there for the students. So I did dental anatomy and occlusion. I did intro to operative dentistry, all of those foundational classes that, you know, as a dentist, you have to learn. And so I did that for a while, and I decided, I said, well, the longer I stay here, the harder it's going to be for me to leave. One of the cruxes that happened there was that when I tried to pursue clinical dentistry outside, they would say, "Oh, you don't practice dentistry. Oh, you're not a real dentist." And I'm saying to myself, wow, you know, I am an educator, you know, I am a faculty person, I am a person that has to step in when the dental student is you know, in a bind, or I am the one that's actually teaching ideal, you know, the ideal things that you should do in dentistry, but yet you question my ability to be a clinician. And so I think that was a hard pill to swallow in dentistry, because you don't think about your career and how broken it can be, or how
Mm.
one way is perceived than the other. And I did think, because, you know, as like I said, the climate that we have, education is not held to a standard that it should be. Educators are not held in high regard as well, because to me, my mentors have been those individuals that decided to devote their lives to teaching others, you know, and you have to know what you're doing in order to teach. And so I did feel that in that regard, there is some brokenness there within our career paths, because you know, you should want somebody that has educated others. You know, you
Yeah.
should, because then that shows they know what they're doing.
Right.
Yes, I have to butt in here just because I can relate so much to what you're talking about, specifically, you know, not just as a clinician, but like as anybody who's going through school and then has a human touch point afterwards. What we're learning in school is current and updated. And a lot of times, especially in dentistry, you see people go off and open their own place and they're not necessarily getting the most updated education when they go for their CE credits every year. And it's, I think, a huge issue, especially in dentistry, because they end up being pretty isolated. They're not often kind of compiled into a hospital setting. That is fairly rare for the industry. And so to get those current updates that are so needed, it's really
Mhm.
good to have fresh people right out of school to bring that
Yep.
influx of information. And I loathe hearing stories like yours because it's just such a detriment to all of those that are practicing. So thank you for sharing. I really appreciate that. My first career was as a hairdresser, and I saw people coming out of school as like a fresh source of inspiration. But, you do have to kind of help them into the industry and train them in certain ways, but like they're bringing the freshest information forward. So we should all be hungry for that. Anyway, go on,
Yeah.
please say more.
Right, right. Yeah, so, I battled with that for a little bit, but finally got a break when I applied to a FQHC, which is a federally qualified health center, and that role was strictly clinical at that point. So of course, I was still sort of green, but like I said, because I had already been out, so it wasn't that bad. And so I was tasked. I went to a very rural part of Tennessee. It probably had like maybe three other dentists there. I would say maybe two or three, and they probably were the private offices. But of course, with the fairly qualified health center, you could see people. We have a sliding fee scale, which means that it goes based on someone's income that they can come and receive their services. We also don't turn anyone away regardless of their ability to pay. So again, we are pretty much what they consider a safety net. At this point in the public health realm, our safety nets are breaking apart because we have
Mm.
such an influx of people that are uninsured, people that are, like we have a lot of migrants that come. So we typically tend to take Medicaid and the other insurances that a lot of private offices don't take. And so it's becoming quite a hefty load for us as clinicians in this space to accommodate everyone because where do you put the patients? Our wait lists are 2 to 3 months because we have just
Yeah.
that much volume. And it's not just our site, it's not just our organization, it's other organizations as well, other community health centers and FQHCs and lookalikes and all of the safety net individuals that are trying to combat this oral disease, these cavities. And so that was my experience into the public health realm as a clinician, because at that point I don't think I really understood social determinants of health. I
Mm.
knew they existed because I had lived experiences in the social determinants of health, and I couldn't put the word to it until I started studying for my master's of public health, because I kept saying these individuals that come, they have so much going on.
Right.
At that time, I was seeing young girls that had been sex trafficked. I saw women that had been battered. They were in, women's shelters. I saw
Mhm.
men that were trying to put themselves back into society from being in the penal system. It was, it was a large amount of, those people that society kind of shuns, or the people that society just kind of says, oh, that's what they have that program for, or, oh, you all need to hurry up and get off of that program because, we don't
Mhm.
want to pay, for you to have these services. And even down to individuals with intellectual disabilities, I used to see them as well. Some people that were nonverbal, I was able to be a clinician for them. And in all of that, I found myself being an advocate for those individuals, even though at the time I didn't put, you know, advocacy, I didn't label what I was doing as advocacy. But as I continue on this journey, I realize nothing is so small that it can't be called advocacy. I would advocate for those patients and say, hey, You can't leave them here if they can't give consent. They need to have informed consent. You know what I mean? Like, just down, and you would think that that will be common knowledge that you can't do those things. And when we talk about human rights and people rights and those things, those small things is what matters. And I didn't
Yes.
realize that at the time, but I was using my voice for those people, for those women. No, we're not going to do this for them. We're not going to, because when we talk about trauma informed care, again, a part of public health, I can't leave this person in a room when they've been traumatized, probably with the lights off, or,
Yeah.
just thinking in those terms. I think as a private clinician, sometimes we lose sight of those things because we don't see that daily. You might have one or two patients that may have had some things happen, but in the public health space, we see those individuals daily. I've experienced mothers that were on, drugs, and they wanted to get off, and they lost their children, and they had to come tell me, I lost them again. Those are hard conversations to have with individuals that are not in your family. I am their dentist, but I ended up becoming their friend.
Right.
So those relationships, to me, is what makes dental public health different than just a run of the mill private office. We haven't talked about corporate offices, DSOs. I had a couple experiences in the
Yep.
corporate realm as well. And so when you think about those things, all of those things connected together really create sort of a holistic environment or a holistic experience for dental public health practitioners, because you have to dive into some things you may not want to do. And so I did that for almost 3 years. And then I decided, well, if I can run this office here, then maybe I should get my own. And so in 2019 is when I actually bought a office from a person that was retiring. And I did it probably 6 months before COVID hit.
Oh,
So
wow.
the timing couldn't
Wow.
have been. And when you reflect and think about experiences that you have, the choices that you make, it's just that just so happened to be the time that that happened, like.
Yeah.
And I don't think anyone had a crystal ball to predict, hey, don't buy this because in six
Right.
months you're gonna shut down. I don't think anyone thought about that. And so, like I said, of course, that was my first experience as an entrepreneur. I don't regret the experience. Of course, it was a very expensive experience to learn, but outside of that, it taught me that you don't have to stay in your situation.
Mm.
And if you realize that you're not being true to yourself and who you are as to your core, like your values, and me being a private practice owner was not in my core value. It just was not. My core values of freedom, of integrity, of, just care for other people, it just was not in my core value. And I had to come to terms with that. I think a lot of people in 2020 did a lot of self-reflection because we had time to do that. We did. We had a lot of time. We had some time to just sit with ourselves and think about some things. And I really did do some soul searching to say, hey, do you really want to do this? Do you really want to continue? And I think some people feel stuck. And I want to let those that may listen, you are not stuck. You are not stuck in any situation. You would think buying an office would be a permanent thing. Like, oh my God, I'm like set up shop here, and I can't go anywhere. I can't do anything. I own this business. No, that doesn't mean that.
Right.
I mean, there are plenty of people that start businesses, bankrupt, open up another one, like,
Yep.
I mean, the possibilities are endless, but I think sometimes, because dentists are perfectionists as well, when you make a mistake, it's difficult to admit that you were wrong. It's difficult to say those things to yourself. And I had to say those things to myself. And then I had to say, well, what does this look like for me in dentistry? What do I want to do that's going to satisfy my core values and who I am as a person, and still be able to contribute to this career path that I've decided to go on? And I think in that office, I decided, hey, and it was kind of on a whim. I saw a ad on a computer for, oh, you could get your master's of public health, and it's from Chapel Hill. And so I applied and I said, well, if I get in, it's fine. Because I didn't tell anybody that I applied. I didn't even tell my husband I applied. He loves me. I love your husband. But I applied and I got in, of course. And the rest is pretty much, like I said, I appreciate it because one of my mentors, they have been in public health for almost 20 years, but they did not have the formal MPH or MBA or anything like that behind their name. So I'm not saying that individuals can't, be on this path and don't have that. But what it gave me was a formal foundation. Like I was able to put words to some of the things I experienced, or definitions to things that, oh, that's what that was, I didn't even know, because we're going through this life and we just have no idea unless you're exposed to it. And so I appreciated being able to have that formal piece to actually put a lot of things in perspective for myself. That's a long journey, but that's how I ended up into the public health space. So now I am currently a dental public health resident for the state of North Carolina in the Department of DHHS, the oral health section. And so, of course, here I'm learning how to actually run a state program, which is one of my career goals moving forward. But like I said, the checkered past that I have, I appreciate at each point I'm able to go back, even though some of those points were rough because not everything was easy, definitely not easy. I could honestly say that it helped me develop my career, my practice, my morals and ethics. It helped to develop all of those things into the clinician that I am today. So I just, yeah, public health is it's pretty great.
That is such a fascinating journey, Sabrina. Like it's obviously very dynamic, right?
Hmm.
From where you're coming from and your experiences throughout that. Some of the insights various mentors throughout that journey provided you that might have been some surprising nudges, such as your biochemistry teacher,
Yes,
right?
yes.
And
Hmm.
that experience in
Yep.
school, the Washington's training program, but I also think the different touch points, primarily probably from patients slash clients and other professionals at the VA onwards, leading you to
Hmm.
become, you know, a director and a public health resident, right, for the state. So that's
Right.
so much of that's fascinating. I'm feeling attention because part of me wants to ask a now follow up question when it comes to case studies. But from your particular journey, I really want to actually focus more on hearing your thoughts on some misconceptions that someone like you experiences, A, from the public, whether it's like patients or other just peers outside of oral care, and then subsequently any misconceptions when it comes to a public health resident like yourself from your peers who are not in the public health domain. Could you elaborate more
Hmm.
on those two?
Yes. So I think from the patient perspective, I always get like, well, why do I need to go to the dentist? Or like, and so I remember being in private practice and the person was like, oh, I'm paying for your Mercedes or I'm paying for that. And I'm like, well, have you seen what's parked outside? The misconception is, I'm not balling out of control, because I think that is a huge misconception with the public in general, is that dentists are rich. Some are, but I'm not one of them. And, I just think that drives a lot of people's perception of, why should I go to the dentist? Like, I don't have a problem. There's nothing wrong with me. And I like to always say, just because your teeth may be white, that doesn't mean they're healthy. And so when we talk about that, like, well, why should I go? And the reason why dentistry is so expensive now is because people wait to get treatment. Like, they're not doing the preventative things they could do before things get worse. And we talk about dental anxiety. Well, if this is the first time I'm encountering you and I can't do a very pretty cleaning on your teeth, but I have to now extract your tooth, I am going to give you anxiety because you have to have something major done to you at the first time I see you, instead of it being, hey, I'm Dr. Porcher, I am here to figure out what your dental goals are, like, instead of us having that conversation. And I think that's what sets dentistry apart from medical as well, is that we are actually physically performing a service on someone. Like in the doctor's office, you can just talk to your PCP. You can just ask them questions. They're not poking or prodding you. They're not, unless you have something planned, you can kind of generally talk about it. But in dentistry, there's a need when someone has an emergency that you have to act on it. Like, you're gonna have to pull the tooth or perform a root canal, or it's something like that, because you are trying to get the person out of pain. And so I think that's one misconception, is that yes, dentistry can be expensive if you've neglected to do the basic necessities that you should do: brushing, flossing, using mouth rinse, going twice a year. And yes, there are some people that say, there's nothing written that says you have to go twice a year. No, there is not. It's not. That's a recommendation. When people say recommendation, that doesn't mean you have to do it, but we're trying to keep everyone healthy, and that's one of those preventative things. I think the hottest misconception now is fluoride. That's like a buzzword now. Everyone's talking about, well, fluoride is unsafe. Fluoride is not unsafe. I think we've had fluoridated water for more than 50 years now. And so I remember growing up as a child, we had well water. We weren't attached to a city or anything like that. So I'm pretty sure my water was not fluoridated. But my mother took me to a pediatric dentist. And so I had access to that. But a lot of my childhood friends, they didn't have access to the dentist. And I remember seeing some of my childhood people, they had cavities on their teeth and different things like that. Like I said, we lived in a very rural part of South Carolina, considered country, farmland, turkey farms, like different things like that. And we had well water. And so I know the importance of it. It is not toxic. It is a very small, minuscule. I mean, like a huge 300-pound man will have to drink like a lot of that water in order to have some sort of toxicity. Like, that is how minute it is. And those misconceptions are just those
I
things.
could go on about fluoride as well. I
Right.
feel you there. I will say that in 70 years since we've had fluoride in our toothpaste, though we haven't had a lot of other innovation. And so I would like to see more innovation, but I don't see fluoride as being something that we should throw in the toilet because I do still think it's useful. And there's plenty of global evidence to show that there are areas like India that have fluoride endemic in their groundwater. And so they actually can't use the 1200 ppm fluoride toothpaste that we
Mhm.
use. It has to be 1,000 or less. And yet they exist and they're doing great. So,
Mhm.
there's a lot of discussion around this topic. And there are so many people in the US without dental access that it's a really hot button
right
issue.
now,
But
especially.
I, you know, hopefully dentistry will keep their paws on it. And even if we do have to kind of exit some of the water fluoridation elements, there are areas that do have fluoride endemic as well here in the US. And there is enough that the CDC has posted for many years now that there is an epidemic of fluoridosis, but dentists are reticent to talk about it because they don't want to see fluoride be taken away. So I think
Mhm.
there's this, hard discussion that we really have to have in the profession of like, how do we get innovative so that we have more options? Because, there's no medicine in the world that can solve everybody's problems. So while I don't think we should throw it in the trash, I also think we should have a lot more options at this point. So, because we know so much, right?
Right.
So, again, I'm with you 100%. I think that, we have to make some pathways into regulatory space so that new innovation can come forward and be really a viable opportunity.
Yes.
But that's
Mhm.
like a whole other
Yeah.
ADA, FDA discussion.
Yeah, I agree. I agree. That's not my ministry over there, but
Same,
we
same.
were saying misconceptions, so that was a like I
No.
said, a buzzword now, hot topic.
Definitely.
So yeah, definitely. I think from my peers, um, it's sort of hard to explain, and I say this, and I'm not speaking for anyone else. I'm not being paid anything else, but dentistry and dentists in particular, I feel sometimes our value is tied to our handpiece. And I don't know if you kind of
Mm.
understand that, but with my peers and even family members would say, well, why are you doing this? Like, why did you go get a second degree? Like, you're a dentist, you could just go, practice. And so I hope to be an advocate that releases the handpiece from us, because dentists are so much more than just drill and fill. We have such a wealth of knowledge that it just baffles me that a lot of our worth is still tied to how well we can practice as a clinician, and not as an advocate for oral health issues, or as a director that would, like you said, form programs for people to have access to dental care. It's like it's so many things that we can do in dentistry that does not rely on being a clinician, like being a chairside doctor. We don't have to be chairside 100% of the time. And I think for me, that was the biggest pivoting point in understanding between individual health and population health. Because at this point, I want to expand, I'm expanding into population health, meaning I want to reach the masses, not just individual practice, which is why I let go of my private office. You can only treat so many people in a day, you can only treat so many people in a month or a year. But if you are one of those people that are sitting at the table, that with those people that are making the policy changes and the legislative changes and the lobbyists that are doing all, if you can be one of those people, that's even better. Because like I said, for me, I've had lived experience. I've had experiences from my patients, their stories. All of those things are important in terms of public health. And when we talk about moving forward with what communities want, now classes are about community engagement, and, like, well, what does the community want? And I think that comes a lot from the dental public health side. Even dental public health itself is a specialty. There are 9 specialties in dentistry. Dental public health is a specialty. You can be board certified as a dental public health specialist. And that's one of those specialties that we don't practice. Like, there's not a clinical requirement attached to you being a dental public health specialist. And so I think for myself and my colleagues, and trying to explain that to them, it takes a little while. But my closest circle of people understand my mission, my goals, what I want to do. And so it hasn't been super complicated to do that. And like I said, because I'm living in half, I kind of say I'm a hybrid. So I'm like half practicing and half doing my other thing until I can completely do what I want to do. That's pretty much where I'm living. But I think that's a big misconception. And I think that's what sometimes may hinder people from moving forward in dental public health. And, when you enter dental public health, it is not to get rich. I can say that as well. It is not like you're going to be balling out of control. It is really a selfless work. Like it's really like a work of from the heart, like it's really, you have to have the passion to want to be in public health in general, because we know that. But I think the drive and the push came in it, and it was very refreshing to see that people actually started to think about public health after COVID. I'm sad that it had to take a pandemic for people to really appreciate public health and actually think about public health and pursue a career in public health. But I think
Mhm.
that was like a major push of people wanting to at least talk about public health. Like, well, what is public health? What do we do in public health? And then you have to kind of connect the dots for people. Like, when we get vaccinated, that's a public health thing, because we care about everybody and we want everybody to be well. And so I think I hope that it's moving in the right direction. I think it is moving in the right direction. I hope that people don't lose hope or steam because, certain elements are upon us, but there always been, elements upon us, whether we,
Right.
want to say it or not. There's always been elements. And so I think we just have to continue, on the path and on the journey and making sure that everyone is being taken care of like they should. So that's what I think the biggest misconceptions, and to kind of combat those misconceptions.
Thank you for that. That's the dichotomy between like the misconceptions from the right patients and the public at large versus your peers, right? Definitely resonated with me when you're talking about decoupling yourself from the handpiece.
Mhm. Mhm.
Particularly, I think many of us, whether in dentistry or not, sometimes may find issue of what that looks like in our lives professionally, and then even how that intersects with us personally when we talk about our identity.
Right.
And so I could see the unique challenges from what you share for what that looks like as a public health dentist,
Mhm.
for sure. I'd be curious to hear more since you're now running a statewide program, right? There's a lot that goes behind that. Are there any modern technologies or tools that's available to us now that's helping you be able to engage or be more connected to your community and or be able to deliver better services?
So I'm not currently running it right now. So I'm still, learning. So where I currently work as an associate dental director, they have a communications team, and that communications team is in charge of the LinkedIn page and Facebook pages and all of those things that engage, because of course, you have to become, you know tech savvy, because a lot of the patients are, some people are like, if you don't have a website, I'm not scheduling an appointment, if
Right.
I can't do it, online. So our company recently has started allowing people to book online, not specifically for dental, but like medical services, they can book online. We send electronic appointment reminders. They can reschedule their appointments through their cell phone. The patients love being able to have that access to their phone. We're upgrading our EDR systems, so that we can run more effectively there. We have not really bought in any AI quite yet, just because, with the FQHCs, and so we have certain limited ability when spending grants and, funding all of that. So we haven't really bought that in. But what we have done is we are utilizing intraoral cameras for teledentistry. And so, of course, that was a buzzword. And of course, it took a while. So during the pandemic, the insurance companies actually reimbursed for teledentistry, because that was one of the things too. Like, we can't go in the office. You restricted us from doing that. people are still having emergencies. We are trying to keep people out of the emergency room. What are you going to let us do so that we can reach, the masses of people? And I think even from that, I had seen recruiters that were using dentists from other states, and they were doing kind of like a
Wow.
triage, system to try to at least help people, write prescriptions, whatever it was. And so for us, we have utilized the intraoral camera. So, like, let's say someone in medical, they have somebody and they have a question about a lesion or something like that.
Right.
You take the picture and then they can send it to us, and then we can evaluate it and, kind of, like I said, triage the person, and then we're able to schedule appointments, and different things like that. So we have kind of utilized that technology to be able to reach more patients that might need some care, and then we offer them to come in. So really, we're just trying to make sure people don't clog the emergency system. And I think there's something else that people need to be reminded of, is that a lot of people were utilizing emergency departments as a dental service.
Yep.
Dentists don't work in the emergency department. You know what I mean? So, like, you can't keep going there for the same tooth that you just need to have extracted. Like, you need to come to the right place. And so, we've been trying to communicate with them, so that we are a referral source. So we make sure that we are open to being a referral source for those individuals that kind of end up in the wrong places, urgent cares, emergency rooms, things like that. So we have done that. And I think from the state side, because the oral health section is kind of small, I think they are trying to revamp their website, and just so that people understand what the purpose of the section is and what their goals are in terms of what they want, what their vision is for the state of North Carolina and what that looks like. And so they are working on that end. So, like I said, as I continue to work and complete my residency, I'll learn more about their processes when it comes to that. But, I can speak to the side that I'm on currently, and those are some of the things we're doing. I have spoken with someone that does oral genome. I don't know if you heard of that, but I have spoken with them. I haven't addressed it to us, but I think those are innovative things as well, using the oral genome. Overjet is an AI that you can do. I've heard of that as well. I don't think we would have overjet, but I don't think that it's necessarily a bad thing. I just think that people need to understand the technology, and that you're not going to lose your job if we use this extra AI piece to help with diagnoses and different things like that. So I do think in the community it's going to take a while. I think it's catching on, but I think it also is going to take a while for people to trust the AI systems and the new technologies, and to understand that nobody's job is in jeopardy. These are just tools to help us to be able to be better clinicians. So I do think that it's probably up and coming, but it's still in the earlier stages. I think people are using it, and probably more in private offices, but not so much in the public FQAC health department kind of realms. So,
That makes sense. That's
mhm,
fantastic.
yeah.
Before I pivot to a question or two with regards to your ebook, Camille, I wanted to see if you had any additional public health specific questions.
I have loads, but I would just like to get your thoughts, however brief, on how we can all kind of think of how to engage in a public health element to reach, like, I think of your specific examples where people don't know not to go to the ER. They're just in pain and having a moment, and that's where they end up. I mean, this is a huge historical problem in dentistry in general. I, fantasize about having an exclusive, instead of a 911, you have a dental, right, emergency call system. But I just think, how do we build and establish this type of outreach to kind of gather up all the pieces? Like you said, you already have people booking months out because there's just not enough. Like, how do we build a system around this huge issue?
So I think part of that involves interdisciplinary connections, so interdisciplinary collaboration. And where I am currently, we are considered a patient-centered medical home. So we have medical, dental, behavioral health, pharmacy, all of those disciplines together under one roof. So those individuals can do that. But of course, in the private realm or outside of those sectors, everybody is siloed. And so in order to do that, I think one of the things is your local dental offices and the hospitals, urgent cares, all of that, they should have some sort of communication between one another. I know that's kind of difficult. We usually in the community, if there's a specialist like an orthodontist or a pedodontist or a prosthodontist, they usually send you their pads for referral. So those individuals and you can so in the past, what I've done at other sites is leave information at the emergency rooms for those people so that they can give that person that information. Sometimes emergency rooms where we've actually given them like a list of places that people can go, to receive care. So that's another thing. But we do need our fellow brothers and sisters in medicine to actually advocate for those people as well and tell them, hey, go to the dentist. So I think that it should be a two-way street. We can't do all the work over here on the dental side and then nobody is reciprocating anything. Like it needs to be a team. It really should be a interdisciplinary team, because when you think about treating someone holistically, it is different individuals from different sectors of healthcare on the team. You can have the medical, the PCP, the cardiologist, the dietitian, like I said, the behavioral health person, the dentist. I mean, it takes everybody to be able to keep everyone healthy. And so I think establishing those communication, the lines of communication, making sure that people understand, giving people information, pamphlets, different things like that can open up the communication for those individuals to be able to refer them to the right places. And I think just a lot of that is just getting the word out and getting information to people, which is the biggest, sometimes it can be a challenge to do that.
Yeah, that's definitely something that, you know, is motivates what Camille and I are trying to do with this podcast is helping to connect people, but also disseminate information both widely, but also in a targeted way to fill in those gaps. That's fantastic.
Absolutely.
So my last question for you, because I can keep chatting about like as a student, right? I feel like there's just so much I don't know when it comes to oral care and oral health in the public domain. But I think just to kind of make things full circle with regards to their story, I also saw that you have an ebook for dental students. So I would love to hear more
Mhm.
about what inspired you to create this nugget of knowledge and maybe provide a little bit of a tidbit or two for those students who may be listening to this.
Yes, so I think I wrote the ebook somewhere around 2020. So it was around the COVID time. And I always say that I wanted to write a book about my journey into becoming a dentist and how I did it, what I did in high school. So the book is really geared towards high school and college students. So kind of like that, because in high school, I started thinking about what I wanted to do in high school. So
Right.
we talked about how we're able to create a workforce of individuals that become knowledgeable prior to college, because I think when you plant those seeds, it has to be early. So, like I said, I started in high school, but you can even go middle school, if you want to kind of try to establish that with them. And so in my book, I talk about, things that I went through in high school and how I went to college, how I applied for scholarships. I think I talk about that in the book, what I did. So of course my undergrad was paid for because I was in the honors college. So I had a scholarship. So I was debt free from undergrad. And so all of my loans came from professional school and graduate school. So I think I talk about that. And so, really it's just a book to inspire them that if it's really something in their heart that they want to do, they can go for it. Like the sky's the limit with everything that you want to accomplish. And there are people in certain places that can help you get there. So, don't think that you have to do it by yourself, or, you don't know anyone. You just have to be open to the possibility of the things that can happen. So that's pretty much what the book is geared towards, and also just trying to help them decide. I think in the book, I don't say I'm trying to recruit you as a dentist. I say whatever it is you want to do, just know you have the power and ability to do it. Like, don't feel stuck in a certain career, or, because like I said, you want to be an astronaut today, but tomorrow you want to be a cook. Like, that's okay. You know what I mean? I
Right.
think it's okay to tell people you can change your mind. It's okay to tell people you can explore and do it and not be tied down to a particular thing. And once you find that thing, that's okay to say, all right, I'm done. I'm done. This is it. This is for me. But I think in that book is really my goal, is to try to make sure that they understand it is possible. You can do it. Even if you have obstacles against you, you can still overcome those obstacles to really do what it is you want to do.
That's fantastic. I love that. Yeah, I mean, I definitely still have my astronaut aspirations, but I'm also grateful for my
Yes.
own pivots and journey in life that's
Hmm.
had the oral health become a key pillar, to say the least.
Right. Yes.
Again, Dr. Sabrina, this was such a fantastic conversation. I'm really grateful that we were able to get you to volunteer some of your time to sit down with us. It was great to hear about your journey. A biochemist, teacher,
Yeah.
being that initial nudge, that's something that you don't
Hmm.
hear every day for those who go down a dental path. And then, of course, everything from your dental training, being an HBC alum, working at the
Yes.
VA, and just all those informed experiences leading to where you're at today is, I think it's great to be able to share that. So thank you for your time, and thank you for everything you've done.
Oh, but also thank you for your service, because choosing non-cosmetic in a
Mhm.
time like this,
Yes.
thank you.
Mhm. Yes.
Seriously,
Really,
Yes.
thank you.
Thank you all. Thank you all for having me.
of course.
It's been a joy and truly inspirational. I think you speak to the heart of a lot of us, really just wanting to do the right thing.